Guys, welcome to the Maximus Plastic Surgery Center. We're going to show you how you're going to be coming in. You're going to be coming into the center, signing in, sitting in the waiting room, and then moving right along. Come on. Hey there, I'm looking to sign in for surgery.
Good morning.
All right.
All right, here you
So you're going to sign in here. You're going to get screened by paperwork. After you get the screening, we're going to put you in our waiting room for now, where you'll sit. Your loved ones and you will sit. You have to bring someone to the center so we can explain to that person how to take care of you. You can't come without someone. You can have someone drop you off that we can talk to. Then that person either goes to the hotel for the overnights and or can go grab something to eat. But somebody has to be with you the entire time. Now, they can go home if it's within 15 minutes, but you have to be able, there's no going back to work for that person. You have to be immediately available. All right, guys, after you sit in the waiting room a little bit, our lovely staff will bring you back to one of our pre-op rooms where we're going to start an IV, check all your pre-operative and intra-operative paperwork, and get started. Come on, follow me. Oh, yeah. All right, we're in one of the pre-operative areas, and as you can see, you're going to get changed out with socks, TED hose that go around your legs, a hat. You're going to put your belongings in this bag, and this is your lovely paper gown. We like paper gowns over the cloth gowns because inherently they're single use. That way it avoids you thinking about whether somebody else used them or not. So this is one of our lovely rooms, has a beautiful mirror, has where we take your vitals, and of course we put on your boots here for pre-op. We put these right on your legs. Your significant other or the person that's going to take care of you will be sitting here and will be receiving instructions from the nurse how to take care of you. So don't fret that you don't remember everything, because that's why you have your person that's with you. Come on, let's walk down the hallway. All right, guys, come follow me to one of the operating rooms where you'll be wheeled out of that room that we just walked into the operating room. All right, guys, so before you go into the operating room, we've already warmed up some blankets in this blanket warmer. We've warmed up the fluids that go into your vein. And if we're doing any lipo, we warmed up the fluids that go under your skin. All this is for temperature regulation, decreases infection, and increases your set point after surgery. Because after surgery, you tend to lower your set point, and you get a little hypothermic or low temperature. With these warming devices, we've warmed up the fluids that go in your body, nice and cozy. So this is our biggest operating room. It's called Room 3. It's huge. We love it because of the windows. So after you come in here, we're going to be laid down on this table. The anesthesiologist will be in here. He's going to get you all ready, meaning he's going to give you something to calm you down, something by the vein called Versed. And after you start to get calm, it's like liquid margarita. Then he's going to put some oxygen on your face, the oxygen, so that you can pre-breathe oxygen to get your lungs filled with oxygen before surgery. Then he's going to give you more drugs to make you even more sleepy. And when you're at the deepest sleep you can, without needing to be tubed, he's going to put the tube in, or an LMA. Then he's going to wrap the tube with tape. Then we're going to prep you for the surgeon like me or any other plastic surgeons here. And then we're going to operate. Afterwards, we're going to show you in a minute what happens to you next. All right, now we're in the PACU recovery area. As you can see, you have monitors here. We bring you in one of these spaces. It's beautifully appointed. And here's where you recover. Basically, the anesthetic that you had gotten in there, it takes about 20 to 40 minutes to come completely out of your system enough that you're waking up enough to go home. Now, if you're one of those patients getting VIP treatment, which means you're going to be overnight in a hotel, what's really cool is that an ambulance team will come get you from this bed, put you on a stretcher, and take you to one of our hotels that we partner with, basically the Drury Inn on Stone Oak. And it's kind of like a good VIP service. Otherwise, you'll go from here straight home with your significant other. They'll come pick you up from the side, and I'll show you in a minute where they'll pick you up. All right, guys, this is where your significant other will come pick you up. As you can see, there's a ramp. If you're one of the VIP patients who are going to be having an ambulance afterwards, you can see the ramp come up like this, and they'll bring up their ambulance. They'll come get you, and you'll bring you out here. If you're in a wheelchair, we'll put you in your car with your significant other, and you'll drive home. Of course, when you're home, you're going to take it easy. Anywhere between 1 to 4 weeks, depending on the the length of your surgery and how much surgery we did. We're also going to request that you refrain from having any showering for at least 2 days unless you were just strict lipo. The reason we wait 2 days for showering is in case you had a breast surgery, we want those incisions to be completely healed before you subject them to water. We do give you a soap called Hibiclens that you purchased before, and we want you to mix that Hibiclens. Showering is usually typically day 2 and then every day after. I hope you enjoyed the tour. Tell your friends. We'll see you here soon.